if you want to make yourself look like a professional versus an amateur, the first thing that you need to do is be aware of how the position of the horse's head and neck affect venous fill. If you want to look like an amateur, work with the horse's head down. I'm not sure he'll put his head down.
I can get it down.
Or turn the horse's head towards you, or both. The fill is never, he's going to be fine, but the vein is not taut even if you can get it to fill when it's down, and the vein will tend to push away from your needle when you try and place it, particularly if you're trying to do a slow, smooth poke. If you're ever forced to do an injection in a horse whose head is down and towards you, you would need to utilize your needle more as if you were working in a cow, where you did a really hard jab. Otherwise, the vein will tend to push away from you. If you want to make yourself look like a professional, start by positioning the horse's head correctly, which would be to raise the head and push the head away slightly. Try not to turn the head when you're doing that. Just raise the head and push the whole thing away slightly. And when they're raised, that stretches the vein out a little bit more, and it will be taut. The other thing you can do here to help stretch the vein out again is when you hold the vein off, you can pull down slightly, and that will stretch the skin and the vein out and make it easier to gain immediate entry to the vein when you place your needle. If you're working with a really, really solid horse, not that Lefty's not solid, but there are horses who are more solid than this, the older stallions can become difficult to see their vein, donkeys as well. In those instances, try and visualize as much of the vein as possible, and if you can't find anything, find the bifurcation. So I can see the bifurcation bouncing right here. Here's where we've split. If you can find where the bifurcation meets the vein, the main part of the vein, you know where your vein is running, and you know where to put your needle. So if you're having trouble, start at the bifurcation and work your way back down.